Good morning, friends. I'm Dr. Pankaj Maheshwari, Senior Consultant and Chief of Urology at Fortis Hospital, Mulund. Retrograde intrarenal surgery for multiple calculi in a calyceal diverticulum. A study presented from Fortis Hospital, Mulund, Mumbai, India. Calyceal diverticulum is a rare congenital anomaly. To a urologist, it usually presents by formation of calculi in the calyceal diverticulum, and they need treatment for management of the pain and recurrent infections related to these diverticulum and calculi. This 40-year-old lady presented with left flank pain of more than 6 months duration. She is obese and hypertensive, and on evaluation was found to have a large diverticulum arising from the middle calyx with multiple small calculi in the diverticulum. A decision was taken to manage her by flexible ureteroscopy or RIRS. As a first step of RIRS, retrograde pyelography was done. During retrograde pyelography, the pelvic calyceal system looked normal. The diverticulum could be identified. The contrast is seen collecting in the large diverticulum. On flexible ureteroscopy, attempt was made to find the neck of the diverticulum, but despite the best attempts, diverticular neck could not be identified. You can see some papillary calcification on most of the renal papilla. The calyx leading to the calyceal diverticulum was identified with the help of fluoroscopy. When this calyx was looked at in detail, it was seen that behind this thin mucosa we could see multiple small calculi, but no neck was identified. Hence, a decision of methylene blue installation was taken. The methylene blue is expected to fill the calyceal diverticulum through the narrow neck, and once the methylene blue from the pelvic calyceal system is washed out, we looked for efflux of methylene blue from a small neck. No neck was found. So a decision was taken to directly cut the small mucosa over the visible calculi. At a very lower laser energy of 0.5 joules and a frequency of 10 Hz, an initial small puncture was made. Through this, the calculi were very clearly visible. Hence, the energy was stepped up to 1 joule and frequency was stepped up to 40 Hz. This opening was gradually enlarged so that all stones can get flushed out through this calyx. The opening should be made large enough so that the flexible ureteroscope can enter this calyceal diverticulum. This would help in two ways. You would be able to confirm that all small calculi from the diverticulum are removed, and further, the opening will be at least 8 to 9 French in diameter. It is usually not necessary to pick up the calculi from the diverticulum. With the irrigation pressure, most of these calculi would get flushed out on their own. At the end, it is confirmed that all calculi has been removed. We can see all these flushed out calculi in the lower calyx. Few larger pieces were picked up by a Dormia basket. A double J stent was placed at the end of procedure. It is not necessary to place the double J stent across the diverticular neck because more often than not, this stent would not stay in that place in diverticular neck. This patient has been on regular follow-up and has been doing good at 1 year follow-up. To conclude, RIRS can be safely performed for calculi in calyceal diverticulum. If neck is not identified, blue spritz technique, that is installation of methylene blue, can be done. If this fails and if you can see calculi across a thin mucosa, then direct puncture of this mucosa with fluoroscopy control can be safely done. Thanks for a patient hearing.